In order to appropriately rehab the shoulder, we have to improve the mobility of the mid-back and the shoulder girdle itself. The muscles on the inside of the spine, called the paraspinals, run from the upper trapezius right by the spine all the way down to the base of the shoulder blade. The rotator cuff muscles that are located on your scapula, the triangular shaped bone, also need to be broken down because of the fact that they oftentimes get overworked. By breaking down soft tissue wise the paraspinals located next to your spine, it's going to allow your shoulder blade to rotate upward more, allowing for improved joint space at the shoulder and less friction, causing less pain. We can use two tools. The Hypersphere Go has 3 levels of vibration. It's excellent to use for breaking down the tissue because when we're breaking down tissue, it's supposed to be uncomfortable. You're making true change by breaking down the tissue. Hypersphere Go helps reduce that pain that you feel during the rehabilitation. In most cases, people just have access to a lacrosse ball. What we're going to do is we're going to find a lacrosse ball and find a wall. You want to start at a wall. Eventually, when you can handle it, you're going to lay on your back on the ball. You're going to pin this lacrosse ball starting up at the upper trap. After every 15 to 20 seconds, we're going to shift slightly down alongside the spine until we reach the base of the shoulder blade. Then we're going to transition to the triangular shaped bone called the shoulder blade. We're going to be pinning multiple spots and adding motion in order to break down the tissue the best. So starting at the upper trap, 3 ways to reduce the muscle tone. You can either pin that muscle 5 to 6 level of intensity and maintain that hold for about 20-30 seconds, then shift to a new spot. Pin and hold. The other way is the pin and roll. Trying to just rub out that knot to break it down. Again, per individual spot along the spine, you want to spend a good 20 to 30 seconds. The last and most effective way of breaking down the tissue is starting at the upper trapezius, we pin it, and then we add motion. You don't want to push past the point to where you're feeling exceptional pain throughout the shoulder. It should be pain-free, but you should feel some tension develop up the back of your shoulder where the ball is pinning. So you 5 to 8 motions, 5 to 8 motions diagonal, 5 to 8 motions out to the side, and throw in some rotation. After 5 to 8 motions, you shift that lacrosse ball down a ½ inch, not on the spine directly, but on the muscles alongside the spine, and repeat. 5 to 8 motions, 5 to 8 motions, 5 to 8 motions, and then rotation. Find a new spot, pin it, and repeat. You want to focus your time and attention on the areas that are exceptionally tender and tight. That gives you an idea that that tissue is dysfunctional. So you want to focus on breaking down that dysfunctional tissue more. It sounds counterproductive to actually beat up a tight and tender muscle, but that's how you rehab the shoulder appropriately. Next, we're moving on to the rotator cuff. The rotator cuff is all the musculature attached to the back of the scapula, that triangular shaped bone. You want to start at the outside of the shoulder. You're going to angle your body accordingly. Again, you can either do the sustained holds, 20-30 seconds. You can roll it out. Or, my personal favorite, you pin and add motion. 5 to 8, 5 to 8. Find a new spot, pin, 5 to 8, 5 to 8, pin. You get creative. Any position or motion that you feel more stretch and discomfort underneath the lacrosse ball, you want to do that motion more. But particularly when we're smashing the rotator cuff, we want to rotate. And we work alongside that shoulder blade and work out all that individual tissue until it's all broken up. Level of intensity, 5 to 6 out of 10. And you want to break down every square inch of the shoulder blade muscles and the muscles alongside the inside of your spine, avoiding direct pressure on the spine itself.